Let's talk about making medication orders for discharge for a prescribing clinician in the inpatient setting. We're starting at the patient's chart face, and we're going to open up a progress note prescriber. We're going to enter the progress note part 2 and expand the medication order field right here. You will be taken directly to the standard medication list. You will not see this button, nor will you see this tab, nor this tab on your version of the program. Right now I have a list of medications that are currently on the patient's MAR. Let me give you a little backstory here for a minute. A lot of times prescribers will order discharge for the patient at 9 or 10 o'clock in the morning, but the patient can't leave the hospital until 4 or 5 that afternoon because their husband or wife can't pick them up. So we want the nurses to be able to access the MAR after you've written discharge order meds and discharge orders and continue to give the medications that are on the MAR right up until the time the patient leaves the hospital. At that point in time, you won't have to do this as a prescriber, but the nursing team can prep this chart for the eventuality that the patient might come back into the hospital. By prepping the chart, I mean the nurse will be able to clear out all medications that are presented on the MAR, clear out the diagnosis, if that's a workflow that you guys want to do, clear out clinical orders, and clear out laboratory orders. So in other words, setting this chart up so that the next time the patient comes in, you've got some clean working fields. So for that reason, medication orders that are for discharge only need to be ordered separately in the program down below here. You cannot come up here to one of these meds that are already on the MAR and say, well, just turn this into a discharge order by clicking this button. Incorrect workflow. What you're going to do is come down here and order each of these meds. I'm going to click the button. I'm going to click start because you're starting them for discharge. And let's say you're going to send the patient home on, let me see here, about trazodone. Going to send the patient home on trazodone and 150 milligrams PO, and this is going to be QHS, for example. And you can put down the reason here if you want to. We've got our trazodone over here was for sleep. And then you're going to send the patient home on, this patient's also on Remeron. They're up to Remeron 45 milligrams. So you're going to start, here we go, Remeron 45 milligrams, PO, and it's QHS or QPM, and this is for depression. So you will need to enter each medication you want the patient to go on, home on, down here separately. Once you've put these in, I like to come over, you need to come over actually, and click this little field here, the trazodone and the Remeron and any other meds that you ordered need to be marked as discharge. By doing this, the program will not push these meds into the MAR, so they won't be duplicated in any way. What's going to happen to them is they're actually going to show up on your discharge summary. And so let's pretend like we've got 4 or 5 different meds in here for discharge. If you want to print out any of these scripts, you can do that from right here. So for example, you can come over here to the Remeron 45 PO QHS, and you want to dispense, I'm just going to go with 30 with no refills times 30 days, and you could print this script out right here. Also, if you have 4 scripts that you wanted to print, if I would do the same thing with the trazodone, we're just going to go with the same numbers here, 30, no refills times 30 days. And if you choose to, if you want to print out the script from right here, you can print it out individually, one at a time, by clicking this button, or you can click print this one and print this one. You can print up to 4 scripts on one 8 by 11 piece of paper. You can come over here and say print selected scripts, please. Okay, I'm only set up, well, let me see if it shows up the second one here or not for me. I might be just set up to show 1 script, but you can see how this paper has been divided in 4 areas, so I could hold up to 4 prescriptions here and I could print them out on 1 piece of paper, and then you would just sign them. Okay. I'm going to click done. Let's just come down here and take a look. These meds are living up here. Start the trazodone, start the Remeron, discharge only. Remember, you can go back and tweak those meds if you need to because you have not compiled the note that they've come from. But we're going to go ahead here and save this. And let's just see what this progress note looks like. And you can see here it's showing all the medications that are still on the MAR. They are shown here. You can kind of see them here, the Ativan and the aspirin and the Aposol and what have you. They're showing in a plain font because they were ordered in a previous note. The medications that you changed on the MAR today, which we didn't do any, or started for discharge are showing right here. Start trazodone, PO times 30, order given by, and it's for sleepiness. And then this one is the Remeron also, and it's showing here for no refills. So now I just click this. If I were to go onto the MAR, these would not be on the MAR. I've electronically signed this. Let's come back here. Let me show you where this goes quickly, and I'll actually do this again when there's going to be a separate training for discharge summaries, but just super fast. You can come in here and make a discharge summary starting from a progress note. I'm not going to fill out any of these. I'm just going to click this button. I'll actually go through these workflows in a separate discharge training video. But I just want you to see that those meds aren't going into a black hole in space, that they actually got pushed out here. This is your discharge summary working area. The trazodone for discharge and the Remeron shows here. And then, by the way, it's also going to show over here, and you'll be able to add other details. So that's it.